Thank you very much. I come from the Norwegian Center for Telemedicine, Integrated Care and Telemedicine, which is also a WHO collaborating center for telemedicine and e-health since 2002. I've been working in different areas when it comes to telemedicine and e-health for WHO and in Norway. I'm part of the e-health technical advisory group in WHO and been involved in the preparation of the WHO guidelines for electronic health records. But since I've only got 15 minutes, I wanted to focus on one specific topic here and then go more in depth in that one. Do I? Yeah. Okay, so the point of departure, my point of departure is that I'm going to talk about health records, electronic health records, as the most important tool for doctors when it comes to documentation and communication, where patients are the object and the owner of the health record in most countries and might also be a partner in the healthcare process. The patient has the right to access the health record. That is no question, or at least now I'm talking about Norway. That is no question. What is being discussed is whether this is good or bad, whether in all situations this is something good to the patients. That is a question under debate. I believe that this discussion should be based on facts, on the practice and research in the area, but it's very often a discussion which is based on our own experience or someone we know's feelings and beliefs. So my point of departure is that electronic health records, having problems with interoperability and so on and so forth, they're here to stay and they are the future, and let's take it from there. Excuse me. I'm going to talk about a project which I'm managing, which is an implementation project in the northernmost healthcare region in Norway. We have 4 healthcare regions. The aim of the project is to give patients electronic access to the electronic health record, which is expected to gain the individual as well as the health service. The project is focusing on people who are often in contact with the healthcare service. So people with chronic diseases and other, like cancer patients and other, which is very often in contact with the healthcare service. Specialized healthcare service, I should add. This is a project that has been going on since 2012. Different aspects of it. It was, in the beginning, it was more like, how are we actually going to do this? How can we do this legally? How can we do it in a secure way? We had a proof of technology project in 2013, but since last year, the North Norwegian healthcare authorities took the project and said, we want to implement it to the whole region. So the large-scale service is planned for December this year. And a very important requirement is that the service should be scalable to the other healthcare regions. So it shouldn't be based on some solutions only for one hospital. We did a small survey of patients who contacted the university hospital where we're based, asking for access to the health record, and we asked them if they wanted to, what they were going to, if they would like to have it electronically, and if they would share it with someone. And 76% said that they wanted the journal in electronic format. 87% planned to share it with others, with their family, with their GPs, and so on. And several of them said they wanted to have the journal as they wanted to learn more about their own disease and their treatment. And those patients who contact the hospital, they are potentially in conflict with the hospital. They are disapproving with the treatment, and they want to bring it to someone else for second opinion. This was done in 2011 to 2012. That was not in electronic format. What happens is that the patient contacts the hospital, and although the journal is in electronic format, it will be printed or put into a CD-ROM and sent to the registered address. So this is a regional project with a national context. The patients in Norway has had the right to access a health record since 2001, so it's not a new right. But since 2012, the Norwegian government said that patients should also have electronic access to the health record. And just to mention it as a start, as I said, it's a national national platform. So there is a national health portal which is called helsenorge.no. You don't have to remember that, but the login has to go through this national portal so that everyone is being authorized as who they are. And there is an agreement between the different health regions that the investments made in one region should be paid, should the others contribute to when they take the service into practice. So just a few words about e-health or health in Norway. Electronic health record is widely in use. In the GPs, everyone has an electronic health record. There are different systems and they don't necessarily communicate with each other. And that is not so strange because it's also not allowed to share health records between illegal units. There are 4 health regions, as I said, and 4,500 GPs. And we have done a survey. First, it was a national survey since around year 2000. It was a DG Sanko-funded project some years ago, where we asked the population how they were using internet or e-health for health purposes. And in 2001, 45% said they wanted to communicate with the doctors via internet, emails, and SMS. In 2013, the figure was almost the same, 44%. And when choosing a GP, online scheduling of appointments was mentioned as important by 55%, e-prescription by 53%, and email communication by 36%. Now, this is only to a certain degree reality even today. So when we are saying patients should access their electronic health record, what do we mean? And I know that there are other countries in Europe where we are looking to Sweden, to Estonia, where patients have had access to their health record for many years. But for us, all documents in the electronic health record that is available to the patients according to the law should be made available by the national health portal. But there are some buts, and there are some documents that are not possible to show electronically at present. We can present rich text format, images, PDF, and so on, but there are some special documents, like for women giving birth, X-ray images, some lab results. We can't show them technically right now. And patients would have automatic access to these documents from a certain date. And that is because there should be a possibility for the doctors to, in those rare cases where patients should not have access to the health record, to note that in the journal. So the aim or the motto of the project is to give as much information as possible, as soon as possible, to the patients, and to avoid having all the papers in a file. So who decides what documents can be shown and which can't be shown? By law, everything, in general, everything should be, the patient has access to everything. Denied access, according to the law, is only when there is a risk of death or severe illness, or if there is information given by third parties. I think this is the same for many countries. The author of the journal, or the one which is responsible for the journal, is the one that can decide that the patient shouldn't have access to this document. And later on, this is the person who can decide whether it should be open or not, especially when it comes to a threatening situation. And when it comes to this date we are putting, which is 10th of October last year, if patients request access to all the documents, that can be made so, but somebody in the hospital has to take medical responsibility for that. Now, this is just an image of most of you can't read it, it is in Norwegian. This is the National Health Portal. You see Min Helse over there. This is where you log in, and you use the login mechanisms as used when you do internet banking. And you have to agree that I accept that this is now I will have access to my journal. I accept and I would like to continue. And then the solution is a very, very simple interface. It's just a list, an introduction text, and a list of the documents being listed, the date, the type of document, the unit where you were visiting, the hospital, and the author of the document. And then you can, of course, sort on the dates and the type of document and so on. We have by now been piloting the service among 500 patients. And we did a survey asking them what they found, how they liked it. It was very positive, I should say that from the beginning. It's very positive, but of course, these are self-recruited patients. They are very eager to use this online service, and they compare a situation when there is no online access. So we need to do it again, obviously. But almost everyone said they would like to use the service later. And 87% said they would like to recommend it to others. So it was very positive. Those 13% who would not recommend it to others, their comments were like, it wasn't exactly what we had expected. And mainly that was because they were thinking they would have access to all journals, like GP's journals, dentist journals, everything. Although it says very clearly it's hospital journals. Many patients, many users think, well, everything about health, about myself, it should be in one place. This is not exactly what we can offer now, although it's in the national plans. And then another crucial thing that we were interested in was how much did they understand of what they read, because this is a typical argument that patients and users, they don't understand the Latin, so what would they need it for? On the question, I understood most of what I read. About 91% understood most content of the electronic health record. Then we had to check, because we knew that several of those pilot patients were also healthcare professionals who were interested to know more about the service. But even when we checked for those who have a healthcare background, it was the same. When we asked more in-depth, if they agreed, I found it hard to understand all medical terminology. It was more, the picture was more, you can see from there, although you can't read the Norwegian, about 50% said, well, they agreed, they found it a bit hard, about 50%, so it said it wasn't so hard. But what we know from other countries, like from Sweden, is that although patients say, well, we don't understand a lot of what is there in the journal, it doesn't matter because I know who to ask. I have a sister who is a doctor, I have a friend who is a nurse, I can always find someone to explain it for me. Now, electronic access to the health record is the beginning. In 2016, we plan to also to give a log report. Those health professionals that have had access to my journal, I should get a list of that online, and I should be able to search for names. And that is, of course, because there is not many, but there is always one or two who access journals they have no right to access to. Also to have appointments with the hospitals online and to be able to change that schedule appointment. To see the status of referrals from the GPs to the hospital, and to have a secure dialogue patient health facility. Laboratory result is also something we would like to see, but I'm afraid that, as a project manager, I'm afraid that our list is already quite long. We might have to skip something because it's only 12 months in a year. So what are the expected outcomes? Why are we doing this? First of all, we believe that it will mean an improvement of the health service, as patients and relatives will be better informed and have more understanding of what's going on. And of course, if I'm a patient, I'm the one who is most interested in what's going to happen to me. I will be the one who will instantly check, now what's happening? I haven't heard anything for a long time. When it comes to online scheduling and online changing of appointments, we expect there will be a lower number of no-show. Other hospitals have reported a 30% reduction of telephone calls about changing an appointment. We hope that this will also mean improved content or quality of the health record, that healthcare professionals will write more precisely, more specific what they are doing and what they are thinking. But this has to be researched, of course. And we hope it will mean easier communication with patient and provider, because what other sectors in the society can you not send an email to, or can you not fill in a form and transmit it electronically, except healthcare? At least that's the case in Norway. Now, challenges. This is what we have enough of. Although there is one hospital in one of the other regions that has been given the report type of document for some years, this is the first time someone is doing this on a large scale in Norway. And we have had a lot of first-time syndromes when it comes to technology, when it comes to secure communication, and when it comes to organization. And this has a lot to do with when you're inside the health service, when you're inside the hospital and you have the electronic health record system, it's something else than when you're outside. So actually those making or providing the electronic health record system has to think in other ways, because it has what is seen inside the system is different when it's seen in a browser. And also that's another thing, that browsers differ tremendously. What works in Mozilla Firefox won't work in Internet Explorer, and it's like a nightmare. We see that there is a limited reuse of services, because one service developed for one region which works perfectly fine with, let's say, 1 million users, it won't scale up to 5 million users. And this is something I think it's just natural when it comes to IT technology development, because you can think as much as you like and scale up your project, but it's only when it's put into practice that you realize what are the limitations. We've had run into a problem with our national coding schemes when it comes to journal documents, which I wasn't prepared for that at all. I thought that was something that is, a national thing. It's something someone is taking care of it, but it's been not being updated for a long time. And since this service is based on a national coding scheme for documents, this has been a challenge. We're working our way around it, but it's been a challenge. And we realized that there is a gap between the legislation and practice, because when the law came out in 2001 about patients' access to health records, that included some time, some waiting time from when you request your journal until you get it, let's say 2 weeks' time. Now, as soon as the document is signed from the nurse or the doctor, if you're online, you'll see it. And that's something that many health professionals are worried about, that is, patients who are hospitalized might necessarily be a good idea when they are reading constantly the report. So what to do? First of all, I think what is important is to integrate this e-service into the work processes, into the procedures, and into the instructions for health professionals. We have in our health regions a lot of regional procedures, like regional procedures about electronic health records. What is it? Who should access it? Who can deny someone's access? And then to take those procedures and just adapt them to this new situation, not trying to make a new instruction for patients' access to electronic health records, because most of it is there already. And also to be very clear to the stakeholders, to the patients, to healthcare providers, who is responsible for what. Some tasks are project responsibilities, but some tasks are just general healthcare providers' responsibilities. We've had so many questions about how should I deal with this situation, and I just have to reply back, what would you do when just someone asks for access to the journal, being it electronically or not? So be clear on what is new and what is not, because the only new thing is actually the timing, that is the instant access and not having to wait. And then to be prepared to abandon the baby or the system, because what works in a pilot, what works in one healthcare region, what works with 500,000 patients might not work with 5 million or 50 million. And it's not waste. I don't think it's waste of time. It's not waste of resources, because we always learn something, and we're not starting from zero. And then to promote research on the potential implications, because I've been reading a lot what has been learned from what has been done in other countries, and there is of course a lot to read, but there are very few long-term research on patients' access to the electronic health record. Well, at least I'm not aware of it, so I would appreciate if I could get some ideas. So we'll end up with saying something about EL trends. I think we moved from this individual access to health, like the individual accessing health professionals via telemedicine, from the system accessing health information more or less electronically. And there's a decentralized health services with more specialized health services, but then you can have treatment in more remote places. And there is a big increase in self-management from patient side. So these patients' access to electronic health records, well, it is empowerment of the patient. I think so, but it needs to be studied. And it's business as usual, because it's not very much new. It's just the timing that is different. Thank you very much for your attention.